Diagnosis of ASD, which is acute stress disorder, can be made 3 days to 1 month after suffering a traumatic event, as ASD is a short-term condition and overall the outlook is generally good. Most people with ASD get better on their own without any treatment. A person can only be diagnosed with ASD by a mental health practitioner that is registered. If they are in South Africa, the mental health practitioner has to be registered with HPCSA. To diagnose, they have to follow properly the DSM-5 diagnostic criteria. This is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition by the American Psychiatric Association. To be diagnosed with acute stress disorder, one has to meet these 5 following criteria. Criteria 1, the person must have been exposed to actual or threatening death, serious injury, or even sexual violation. Criteria 2, they have to present symptoms, and these symptoms have to be following under the 5 categories of symptoms of acute stress disorder, which is intrusion, negative mood, disassociation, avoidance, and even arousal. Someone who's affected by ASD will present at least 9 out of the following 14 symptoms from any of the categories. Criteria 3, they have to meet the duration of the disorder in which everything must have been transpired within a month. Criteria 4 is that the symptoms must cause significant distress. The symptoms must be severe enough to cause impairment in one's way of living, such as through impaired performance at work or even inability to participate in social activities. Then we are going to the last criteria, which is criteria 5, which is ruling out other causes. The mental health practitioner must rule out other causes in order to make the diagnosis of ASD and also establish that a particular traumatic event is the root cause of the mental disorder.